I would take a chair, and because it's the shoulder, I have to have something I'm compressing into. So maybe right here we start with a short humeral lever, check tension, compression. His ease is compression. That's easy. We compress, we wait, we get a bit of release. There it goes. It bleeds off that tension. And you like that. That felt good. Yeah, you started to relax, didn't you? So what was happening was I hadn't done the capsule yet. And in this case, the capsule needed enough bit of initial relaxation to let me work the surface tissue. So that when I bounce him, see, this is unacceptable bouncing. It stops. There's no spring. He doesn't spring. And I'm saying that basically you should be able to spring. So this is sort of when the question was, when do I use that motion? When I'm assessing that the cage is so compact and I don't want to just keep pressing and frictioning. Remember, I'll come back to pressing and frictioning, but I want to move around there we go. And give him a little oscillation. Let him know he's alive. He can breathe. The world's good, even if we also know it's sort of not, but we've got to at least try to make the world good. There it goes. There's some movement for him. There's a little bit of spring. Again, I don't have to get 100%. Also, diaphragm needs work. This area is holding this area. So we go back into the shoulder now. I can probably now pick up, I can pick up the pec, do a pin and shift. I go back into the lat, do a pin and shift. I can now try to find subscap. He's still a little tight in letting me get to the subscap, so I'm going to again throw that armpit fascial technique on. That's ease. That's ease in the twist. I'm going to wait right here. He's going to take a breath, try to drop his shoulder. That's perfect. Breathing deeper now. There, at least there. You see it came up now. First time I could feel him breathe up into the chest. If he can't breathe into the chest, I can't get this tissue also to be as responsive, because isn't it the oxygen that's and there's the release. We just got it. I put it down, and now see, he's got bounce. So see how one feeds the other. Yeah, there's your first sensation wash. Really. Tell him what you're feeling.
Shoulder is resting properly.
It feels like it's resting properly.
I don't know what it is actually pulling, or it's not resting, but actually it's resting. Maybe as you said, it is capsule.
Yeah, and of course.
Even I did many tightness of stretching, release, everything I did, but I never got this relief.
No, you haven't. Let it go. Let it go. Because it's quick, it works, it's effective. It's just getting that sense of, how to feel it. And of course, he's got very tight, a whole line of anterior deltoid moving into bicep tension. That means now for the first time, his seam is tight. No one's ever worked it before. Who's working here?
Yeah.
Let's have you sit in there and I'll guide you through the seam work. So let's talk intermuscular septum, because that's sort of the next piece. And then contract, relax again on the subscapularis. So now once you find it, so you put it down for a second. Let me do it on you. This is how it'll have to be. Drop it. So we want to go in here, but what we're going to try to do is use that whole line of the finger. And then when I even hold it, what you can do then is use the rotation motion to move it first as the strum, and then you can do this. And then once it lets you do it, then you individually, like a harp string. I always call this the harp string strum, where it's a gentle strum, not a. It's a. So then